Hello and welcome to the third webinar in the series of the nuts and bolts of telemedicine. Today's webinar will cover the topic, can you see your provider? And we will cover some more essentials for a family-centered telemedicine experience. First, we'd like to start off with a statement from our funders. Our funding comes from HRSA, the Health Resources Service Administration of the U.S. Department of Health and Human Services. We'd like to thank our funders for this opportunity to share this information. And we always like to start off with a quote. Wherever the art of medicine is loved, there is also a love of humanity. Hippocrates. So what will we talk about today? We will cover tele-what, as we do in every webinar, and we will talk about the Fab Four. Then we will go into some more details about hardware and software. We'll answer that burning question, how do I see my provider? We'll compare and contrast a portal and a platform, and we'll share 4 ways to see your provider, 4 keys, including email, text, login, and calling your provider. We'll talk about 5 specific aspects and examples of platforms and portals, and we'll give a word about HIPAA as well. And finally, last but not least, but we will talk about how you can test the platform or portal that your provider uses. Before we get started, let's talk about some learning objectives. At the conclusion of this webinar, we hope that you should be able to determine if you have access to a tele-ready platform to see your provider for your telemedicine visit. This is a simple yes or no question. Objective number 2, if you do not have access to a tele-ready platform, identify 2 options so that you can access a tele-ready platform that your provider is on. And objective number 3, if you do have access to a tele-ready platform, demonstrate 1 way to test the platform prior to your telemedicine appointment. So you might be wondering, what does telemedicine even mean? We are going to talk about the tele-what and the digi-what of all of these terms. Telemedicine is often used interchangeably with the word telehealth. But technically, telemedicine is focused on the clinical aspects of care, such as a video appointment with your child's pediatrician or a virtual therapy session with your young adult speech therapist. Telehealth is represented by this broader orange circle here, and it means the use of electronic information and telecommunication technologies to support a number of different activities, such as long-distance clinical health care, patient and professional health-related education like we're doing here today, public health and health administration. Some of the technologies that are included in telehealth include video conferencing, the internet, store and forward imaging, streaming media, and terrestrial or landline and wireless communications. An even broader category is called digital and connected health. Digital and connected health is the use of digital, mobile, and wearable devices that facilitate the tracking and monitoring of health status and behavior outside the clinical encounter, with the goal of fostering more patient-centered, technology-enabled, and insight-driven healthcare. So all of this together is the world of telemedicine, telehealth, digital and connected health, and we are going to be focusing on the telemedicine appointment in the green circle. By focusing on the Fab Four, we will share with you how to have a family-centered telemedicine appointment. We've already gone over in webinar number 1, Are You Connected?, about how to be connected through electronic means to your provider. We've also talked about in webinar number 2, do you have a device or the equipment that you need to actually connect to your provider? Today, we will talk about seeing your provider and how to make those connections work. And last but not least, in our 4th webinar, we will cover an example of tips and tidbits for your family's first telemedicine appointment. As I said, we're right here where this orange arrow is on number 3 today. In our last webinar, we reviewed some terms called hardware and software. We focused mostly on the hardware piece of it and devices in the last webinar, but today we are going to be focusing on software. Software is something that you can't necessarily see or put your hands on, but it is the instructions to help a device, a computer, a tablet, a phone, run a program. Some of these softwares can be referred to as programs, apps, applications, and so on. So how do I see my provider? To see your provider for a telemedicine appointment, you will need software. This software is often referred to as a platform, which may be accessed through a portal. Don't worry, we'll get to those words in a minute. These platforms and portals are needed not only so that you can see your provider, but so your provider can see you. And so it's a two-way interaction. So let's talk a little bit more about platforms and portals. A platform is simply a secure telehealth software system, which allows a provider and a patient to have a secure two-way interaction for a virtual visit or a telemedicine appointment. And a portal is simply a website or a web page providing access or links to other sites. We'll deep dive into both of these more in a moment. So what are some ways to see your provider? There are over 150 different ways you could actually see your provider with different platforms that are on the market. We're going to just talk about a few here today. Skype is a popular platform that you may have used with family and friends that's also been used for telemedicine. Amwell has been used for telemedicine appointments. You may have heard of VC or DoxyMe. Microsoft Teams is one that's been talked about a lot recently. MyChart is a particularly popular one with children's hospitals and pediatric practices and large institutions. eVisit is another telemedicine platform provider. Zoom is increasingly used in the business world, but also in the healthcare world for telemedicine appointments. And then many hospitals have their own customized portals and platforms for their patients and providers. And so there are a number of different ones that come under this category of hospital portals. With 150 of them to pick from, you're probably a little overwhelmed by trying to know how you will pick the right one for your appointment. Be assured, though, that you don't have to pick. Most oftentimes, the provider will choose the way you will see them by them picking the doctor's office, the therapy office, the institution, the health system will pick the platform or portal their practice will use for their telemedicine appointments, and then they will communicate that information to you as the patient. So I'd like for you to imagine just for a moment how you enter the exam room for an in-person visit. Just as you will walk through that door into the exam room and see your doctor for an in-person visit, you will also have to open a virtual exam room door to see your doctor for a virtual visit. We have a key here because this step looks a little bit different in a virtual visit or a telemedicine appointment. There are actually 4 different keys that you might need to virtually open this exam room door. And we're going to talk about those 4 keys right now. One might be an email. You may receive an email from your provider that will help you open that virtual door. The second one is a text. Your provider might send you a text that can help you open that virtual exam room door. The third might be something that you have to log into, like a portal or go onto a platform with a login. And this is the third key that might be needed to open that virtual exam room door. And the fourth key, last but not least, you may need to call your provider if you're having difficulties opening that virtual exam room door. In-person visits, as you know, do not require you to carry around a key to get in to see your doctor when you get to the office. However, for telemedicine or virtual visits, a key is necessary, and for a couple different reasons. One, it's to protect your identity and to verify your identity so that the doctor's office knows it's really you that they're having an appointment with. And it's also for your security and confidentiality purposes, so that not anyone can join your appointment time with your provider. So we hope that these 4 keys will become much clearer as we talk about each one of them individually. So let's start off with the first of the 4 keys, email. A provider might send you an email with instructions on how to access or see your provider for the telemedicine appointment. So there are a few email words that we need to know. First is, what is email? Email are messages distributed by electronic means from one computer to another. This does require that you have an email address to send and receive. You can think of email as an electronic letter. Instead of going into your real-life mailbox, it goes into your electronic mailbox on your computer. Login simply just means that a username and password would be required to get into a private website or to log in to a private website. Login can also be used when you're logging into your email account. Username means an identification used by a person with access to a computer or online services. And last but not least, a password is a secret word or phrase that may be used to gain admission to something, such as gaining admission to your email account so you can read your email. Let's look at a video that talks about how to create an email.
And now once you have your web browser open, you want to just go and type in Google. You want to get over to the Google homepage. And once you're on Google, you want to left click on the sign in button near the top right corner of the web page. Now you want to left click on the area that says create account. So left click on that one time. At this point, you want to insert your name. Insert a username here. So whatever your username wants to be. Doesn't really matter as long as it isn't taken yet. And then you want to insert password here. Then you want to left click on next. So if you don't have a strong password, it might prompt you to type in a better one. So just make sure you take note of it somewhere. And then left click on next. You will need to verify with a phone number. So let me type the phone number in here. You might have to change the country code on the left side. And once you're done inserting your phone number, it should create the account. So you might have to sign off on a couple additional term of service notifications, but other than that, you should be all set up.
So that was just one example of one type of email account, a Gmail account that is free to set up if you do not have an email already. Because if your provider chooses to use email to let you know the instructions on how to join the telemedicine appointment, you will need an email account. So hopefully that video was helpful if you do not already have one. Let's go to the second key. The second key is text or text messaging. And there's some words we need to know for text messaging. What is a text message? Text message is just a short message sent electronically, usually from one cell phone or mobile phone to another. We also need to know the word link. We've mentioned that before, but a link is short for hyperlink, and it's a web address It's a reference to data that you can follow by clicking or tapping, and it takes you into a web browser and opens up a website. You may have heard, when you talk about text messaging, you may have heard people say, I'll send you an SMS notification. SMS just stands for Short Message Service, and it refers to text messages. It's another name for text messages. There's also a terminology called MMS, and it stands for Multimedia Messaging Services. Multimedia messaging services contain pictures or videos. Text messages, or SMS, just contains the words and characters and letters. So let's watch a text message video to understand a little bit more about how this can be a key to opening up your telemedicine appointment.
Now back to your visit. When the dermatologist is ready, they'll start the telehealth visit and the patient will receive a text message. The patient will then select the link within the message and be taken to the Pocket Patient app. The patient will enter their last name and date of birth and press the button to log in. Then they will select Join Video Visit to meet with their dermatologist. If the patient experiences any technical issues, they will need to contact your office for support. During the visit, the patient has the option to turn on their flashlight and use their back-facing camera for the highest video resolution. This will give the dermatologist a better view during the visit. To examine the patient's arms, have the patient hold the phone so the back camera is facing the skin. Tell them to keep the camera about 5 inches away and shine the flashlight on any rashes or lesions. Make sure their camera is centered and tell them to move their phone slowly for the best view. If necessary, remind them that the camera is located in the upper right-hand corner of most phones.
So that was just one example of how a provider's office may communicate with you through text message to let you know that the doctor is ready to see you. They may send you a message right to your phone, and it will contain a link, which when tapped will take you to a website where, as you saw in the video, you might need to add your name or your date of birth or other information so that they know it's really you, and then you will be let into the telemedicine appointment. Let's talk about another key. This third key is called login. And login, when we talk about login, we're talking about logging into a portal or a platform. As we talked about before, these are the definitions for a portal and a platform. A portal, again, just to remind you, is a website or web page providing access or links to other sites. A platform, on the other hand, is a secure telehealth software system which allows a provider and a patient to have a two-way video interaction for a virtual or remote visit. Let's talk about a few login words you may need to know. A few of them we talked about when we were talking about email. We talked about the word username, the word login, and the word password. And just as we use these terms to define how you might need to log into an email account with a username and password, these same terms apply for portals and platforms. You may need a different username and a different password to log into a portal or a platform in order to access your telemedicine visit. Some other words that we've talked about are websites and web pages. A web page is just a specific collection of information provided by a website. Web pages can be thought of as pages in the book, and the website can be thought of as the book containing all those different pages. These are not a physical book, they are located electronically online. Software is another word that we've talked about before, and as we've said before, they can be the programs, applications, or apps for short, and operating instructions for the computer. And apps. What are apps? Apps is just short for application, and it's the same thing as a software program. It's most often used to describe programs on mobile devices such as smartphones and tablets, and is usually represented by small icons on the home screen of your smartphone or tablet. Let's take a look at a login portal video example for my chart from Texas Children's Hospital to get an idea of how this might look. Again, this one is specific for a specific children's hospital, and your children's hospital in your area might look a little different, but hopefully this will give you the idea.
Meeting with a Texas children's provider for a video visit is a convenient, safe way to receive care. You can complete a video visit using a computer or mobile device such as a tablet or phone. Let's get started for first-time users on how to complete a video visit with a mobile device such as your phone. Once you receive confirmation that your upcoming appointment is a video visit, download the MyChart and Video Connect apps from your App Store. Next, visit texaschildrens.org/videotest to use Texas Children's Testing Tool to check your device's audio, video, and internet connection to make sure your device is compatible with MyChart video visits. Now you're ready. On the day of your appointment, about 30 minutes before your video visit appointment time, log into your MyChart app and go to Appointments. After completing pre-check-in, click Begin Visit. If you don't have the Video Connect app, follow the prompts. Once you've downloaded the Video Connect app, return to your video visit in MyChart. Click Begin Visit again. At this time, the Video Connect app might ask you to sign into a portal. Please disregard this screen and return to MyChart. Next, click Begin Visit one more time and wait for your provider to join the call. You may see a black screen until your provider joins the visit. You're all set now.
So there we saw an example of how to log into a portal called MyChart to be able to access a platform, Video Connect, to see your provider or your child's provider. Again, this was just one example of one platform and one portal. Your provider may use a portal that looks slightly different. Even versions of MyChart at different locations can look slightly different. So it is best to check with your provider for instructions for their specific portal. And last but not least, we have Call Your Provider. And the Call Your Provider key is really if you have any difficulties at all, or you're running into any roadblocks or barriers, we urge you to call your provider at their office phone number and ask for help. So let's talk about HIPAA. You're probably wondering, what is HIPAA? HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA what? Can you say that 5 times fast? Let's talk about what HIPAA actually does. HIPAA is a law about health information. HIPAA created rules about the way private and protected health information, sometimes called PHI, can be shared, stored, and used by anyone other than the person that it's about. Most of your health information is protected under HIPAA, such as personal information, things like previous health history, health status, or payment information. But some information can be included in databases without your permission. And that would be things that doesn't explicitly link to you. So any data that is more or less anonymous can be added to medical databases under the HIPAA Act. So you might be wondering, what does this mean for telemedicine and telehealth? Well, during a public health emergency, such as the COVID pandemic, providers can use non-HIPAA compliant platforms if it is done so in good faith and the platform is non-public facing. What do we mean by that? Let's give some examples. So in a public health emergency, a provider could use something like FaceTime, Facebook Messenger, or Skype, which are traditionally not thought of as HIPAA compliant platforms, meaning that they have extra securities built into them to keep your data confidential and safe. However, there are some platforms that are not allowed because they are public-facing platforms such as Twitch, Facebook Live, TikTok, and YouTube. Let's go in and look at a couple more examples of this. Let's take 2 platforms, for instance, MyChart and TikTok. One is a social media platform, TikTok, and one is a telemedicine platform, MyChart. So which of these two scenarios is HIPAA compliant? Logging into your appointment through the password protected MyChart that's offered by your children's hospital portal, or going on TikTok and having a telemedicine appointment with your doctor? Hopefully you picked MyChart over TikTok as being the HIPAA compliant platform. MyChart is HIPAA compliant, TikTok is not, and even during a public health emergency, TikTok should not be used and could not be used for a telemedicine appointment. Let's try two more. Zoom and FaceTime. So let's consider these two scenarios. Which one is HIPAA compliant? The Zoom link your child's doctor sends you in the email confirming your appointment, or jumping on FaceTime with your doctor? Hopefully you chose Zoom, because Zoom is a HIPAA compliant platform. FaceTime, however, is not. However, can be used during a public health emergency if used in good faith and not used in public. So there are 5 different platforms that we'd like to highlight. Again, there are hundreds of platforms available for telehealth. The information presented here is not an endorsement by Family Voices or anyone else about the platform. It is just some of the ones that many of our families that we work with are using frequently for telemedicine. So the first one is DoxyMe. We'll talk a little bit more about that one in a moment. The next one is Zoom for healthcare. Number 3 is Microsoft Teams. Number 4 is a provider or health system specific portal. And number 5 is something called an on-demand visit provider. And we'll talk about all of those in more detail as we go into each one. With all of those different examples, you may be wondering, are there really more than one that I'm going to have to use? And the answer is yes. You may have to use different methods to see different providers for telemedicine appointments. For instance, your child's pediatrician may use a Zoom platform, but their pediatric cardiologist may use the hospital portal because they are part of the hospital system. And those may look very different on the way you access the Zoom for your pediatrician and the child's cardiologist through something like MyChart or the hospital portal. So we just want to mention this to be aware. We know it can be really confusing and overwhelming, and we encourage you when you do have a telemedicine appointment to write down the details on a separate sheet of paper for each provider so that you can keep it handy for the next time you meet with them. Most platforms do include some common features that are common to all of them. So all of them usually do video calls, since that's the point of a telemedicine appointment. Many of them do video chats, and some of them, quite a few of them, have shared screens where the provider can share their screen with you, and possibly you can even share your screen with them. As we mentioned before, all the ones we're talking about here are HIPAA compliant. And let's jump right in to talk about DoxyMe. This is a website where you could find more information about DoxyMe. DoxyMe supports 9 languages, including English and Spanish. And one of the key benefits of DoxyMe is there's no need for the patient, on the patient side, to download any software or create any accounts. So there's no username, password that has to be created when your provider is using DoxyMe for telemedicine. It is a HIPAA compliant platform, and it is available to providers on the internet. Let's switch gears and talk about our second platform, Zoom. Here's where you can find more information about Zoom. Zoom supports 11 languages, including English and Spanish. And there is a very specific information that we would like to share with you about Zoom being HIPAA compliant. So there are 2 types of Zoom accounts. There is zoom.us offering a free account that the public can access, but is not HIPAA compliant. So that would be one that maybe you're using for a church group, your kids might be using for school. Oftentimes these are used in community settings, except they are not HIPAA compliant. So for healthcare, your provider would need to get a specific license through zoom.us/healthcare, and that is a HIPAA compliant platform. It might be good to ask your provider this when you're setting up your appointment so that you know that their Zoom account is HIPAA compliant. Let's take a look at a Zoom example of how that might look when you access your telemedicine appointment.
I'm going to teach you today about how to do a Zoom video conference with your provider. SCCA uses the Zoom video conferencing application for all telehealth appointments. Zoom for Healthcare is HIPAA compliant and protects your privacy. You will need a computer, tablet, or phone with a front-facing camera in order to do your telehealth appointment. If you do not already have the Zoom software, you will need to download it. If you are using a phone or tablet, download the Zoom app from your app store. If you are using a desktop or laptop computer, visit zoom.us/download to download the software. The app and software are both free to download. To make sure you're prepared, we recommend downloading and testing the software at least 20 minutes before your appointment. Zoom should open in the app on your phone or tablet or on your computer. If you are using a computer, find the email you received from SCCA confirming your telehealth appointment. Click on the link in the email, and if you do not already have Zoom, you will be prompted to download the Zoom software to use on your computer. When prompted, select Run. You do not need to create your own account. A box will prompt you to enter your name. Enter your first and last name. The toolbar at the bottom of your screen should look like this. You may have to hover your mouse over the screen on your computer or tap the screen on your phone to get this toolbar to appear. You will also need to make sure that your video has started. If your microphone, speakers, and video are not turned on, you will not be able to speak, hear, or see your provider. Make sure that your microphone and speakers are not muted. If there is a red line through the microphone above mute, click on the microphone to take yourself off of mute. You should be able to see and talk to your provider. They will ask for your phone number so that they can call you in case something happens with the technology. When you are finished with your call, click Leave Meeting in the lower right-hand corner of your screen. If you have a future telehealth appointment with your provider, you will not need to download Zoom again. When it is time for your next appointment, you can click the link provided by your care team and start at the step where you enter your name. Thank you for watching this video. I hope this information will help you with your telehealth appointments.
So we just saw an example of how your provider might send you an email with a link to Zoom and what that Zoom platform might look like for your actual telemedicine appointment. We hope this was helpful for you. For all the other platforms out there, you can usually Google the name of the platform and video, the word video, to see if there's any tutorial videos out there to help you if you're having trouble with any of the other platforms. Another platform is Microsoft Teams. This is a very long website to get to it, but that is where information is located about Microsoft Teams. And Microsoft Teams supports 36 languages, including English and Spanish. This platform is also HIPAA compliant. And just a note, this platform is in the process of replacing Skype Business and Healthcare, which was also a HIPAA compliant platform and will be discontinued. The Skype platform for healthcare will be discontinued in July 2021. Now we're going to talk about the provider or health system specific portal. We've mentioned this in the past, like a children's hospital having their own patient portal, or maybe you go to a health system where your pediatrician and your children's hospital are connected to the same group. They might have their own portal. But basically what this means is there can be hundreds, if not thousands, of different healthcare branded patient portals. Most are HIPAA compliant, but because we don't know specifically which one you're using, it's always best to ask your provider about their specific portal and whether or not it is HIPAA compliant. A few popular portals include MyChart, and then, as we've said before, many hospitals have their own specifically designed portal. Let's share with you what a portal might look like. This is an example of one from Children's Hospital of Pittsburgh, and it's called MyCHP. You can see a box there for a username or email address, and you can see a box there for password. So this is the login screen to get into the portal, where then you may be able to access a telemedicine appointment. There's lots of things you can do within a portal besides just have a telemedicine appointment. For instance, many portals allow you to schedule an appointment, give family access to your child's medical records, message your provider with a chat or email. You can pay your bills in there in some portals. Sometimes you'll find lists of medications for your loved one, a health profile, sometimes even getting directions and finding other doctors who are in the system. And so a portal does much more than just telemedicine appointments. And last but not least, we'd like to talk about on-demand visits. On-demand visits mean that you will not be seeing your provider who you've met before. You will not be seeing your pediatrician or your PCP or your cardiologist or your child's gastroenterologist. You'll be seeing a provider who you have more than likely not met before. And the reason for that is that these are on demand. These are meant to be able to be contacted and not have a wait time, not have an appointment months in advance. So some examples include Doctor on Demand, Amwell, MeMD, Teladoc, MD Live, and there are many more. Payment for these is sometimes out of pocket primarily, but some visits are covered by insurance, and some insurance companies have contracts with a specific on-demand provider that they may only cover that one. So it's best to talk with your member services for your insurance company first before having one of these visits. And that way you will know whether you will be paying out of pocket or not. Again, these can be convenient, they can be quick, but they do have a limited scope as to what can be treated. Many times it's for very minor things, and sometimes they can provide prescriptions, and some of the on-demand visit platforms cannot. We hope that's given you a great overview of some examples of the platforms out there, reminding you that there's many more that we haven't covered here today. But let's switch over and talk about a family story and their experience with seeing their provider. So this story starts with a grandmother who is attempting to schedule a visit for her granddaughter. The pediatrician's office tells her that they can see her with a telemedicine appointment. So the grandma, not being familiar with telemedicine and not having ever done a telemedicine appointment before, asks, "How do I do that?" The person on the other end at the clinic explains that they'll send her an email 24 hours prior to their visit and then hangs up. The grandmother is not real familiar with email. She doesn't use it on a daily basis. And so after hanging up the phone, she really feels unsure about how to do this. She has a lot of anxiety, and so she calls back into the office saying, "Hey, is there any way we could do this by phone?" And the office staff replies, "Yes, of course, the doctor can call you instead of doing a video call if that will be more comfortable for you." As she hangs up the phone a second time, she sighs a big sigh of relief. "Ah," she says, and the grandmother felt so much more relieved. For instances like this, where you are not comfortable or a loved one is not comfortable or a extended family is not comfortable doing a telemedicine appointment for your child or youth or yourself, it is okay to call your provider and ask for a different situation, a phone call, or if they are seeing a limited number of people in the office, to request that an in-person visit be scheduled if you feel comfortable with that. So these are just some options, but we wanted to just share this family story with you because we felt it illustrated that sometimes telemedicine might not be the best solution for a family. And in those cases, we need to be advocates for ourselves and our children and work with our providers to find out what will work best for everyone involved. So let's take a quick review of the 4 keys to see your doctor for your telemedicine appointment. We have that email key, the text key, we have the login key, and the call your provider key. But you might be wondering, what if I'm having trouble seeing my provider through telemedicine? What if my keys aren't working? What if email, text, login, and even getting a hold of my provider is not working for me? Well, we have some options for some alternatives. Trying to reach your provider is really the best option first. So in this blue circle here, we have some ideas for reaching your provider. You can call the provider line, the office line, and many times on the phone tree, they'll have pick 1 for this, pick 2 for this, or push 1 for this, push 2 for this. Sometimes they'll say, if you need to speak to somebody right now or speak to a nurse right now, urgently, press 4 or whatever the number is. It's best to pick that option if you're really trying to get a hold of somebody and you can't get a hold of somebody. That will send you to a real life person who then can maybe get you to a person in the office that helps with the telemedicine visits. Next, you can reach out to your provider or their staff a couple days before the telemedicine appointment and just ask if they would do a walkthrough with you, if they would stay on the phone with you as you went through the steps. Some offices may offer this. It's best to just ask. And then last but not least, for calling your provider, you can ask the provider if you can be seen in the office using their equipment. Where someone can assist you, meaning that perhaps you can have a telemedicine appointment while you sit in your provider's office, but maybe the provider is not there, or maybe the specialist that your child needs to see is in the far off location, but then someone at your PCP's office might be able to help you walk through that telemedicine appointment and get connected. There's also some options here in this peach circle for in your community. You can reach out to individuals at your place of worship. Many times they have tech-savvy individuals there. You might have a neighbor that might be able to help you navigate getting online to see your provider. The library staff can be a great resource because they sometimes have even a tech department in the library that can help with connectivity, and sometimes they even have small rooms that you might be able to sign out, a conference room where you can have a quiet place. You can phone a friend, you can ask a friend over the phone if they could help you with getting connected. And you can always ask a teenager because teenagers are very tech savvy. This is a generation where they've grown up with the technology, and so they are very comfortable with it, and they might be able to help you get online to see your provider. And last but not least, Family Voices staff is also available and has some experience with this, and so they might be another option for helping you get online and logged into the portal or platform that your provider needs you to be logged into so you can see your provider. So now we come to the part where we want to talk about testing your platform. So at least 2 days before your appointment, you want to give yourself a little bit of time. It's best to go to that website which was in your email or text message. or if you were given a portal to go into, and you want to go ahead and try logging in and make sure that you can get into it, or tapping the link that comes on your text. Sometimes the text ones don't come till just before the appointment, but if you haven't received anything by text and your provider has told you should get something by text, you want to let them know you haven't received anything about 2 days before the appointment, so you can make sure that there's no glitches on the day of your appointment. If you cannot access the platform or portal and you do not have an email or text link, again, call your provider at their office phone number. And it's really important not to wait till the day of your appointment to do this, or even minutes before your appointment time is to occur. So give yourself a couple days before that appointment to check in, make sure that you have what you need. If you're not seeing any of that in your email, text, or you don't have the information about the logging in the portal or platform, then reach out to your provider and ask them to resend it, or to give it to you over the phone so you can write it down, so that you are all set for on your appointment day. And we like to end up with this quote: "Who nowadays would ever use a bank that makes you come into a branch to access your money? 5 years from now, the question will be, who is going to go to a doctor's office that makes you come in every time you have the sniffles?" And this comes from a former head of the American Telemedicine Association, Jonathan Linkus. And it's true. We are in a fast-paced, moving society right now, and very few of us enter the bank to withdraw money anymore. It's all done through a drive-through, through an ATM, through electronically, through online banking. And so there's hopefully we're seeing that is happening with healthcare as well, that we can access our doctors in different ways, and more convenient ways for ourselves and our families, as well as having greater access than long wait times, or taking off from work, or traveling long distances. So we're coming to the end of our webinar now, and we just want to offer, if you need assistance seeing the provider so your loved one can have a telemedicine visit, please reach out to the nearest Family Voices affiliate or the Family Health Information Center in your state or territory. You can go to familyvoices.org to see a map and find the one that's closest to you, and then give them a call. And we are just so thankful for you being here today and listening to how to see your provider. Please be sure to check out the next webinar in our 4-part series, which will be part 4. And if you missed parts 1 and 2, please check those out as well. Thank you.